The final years of med school were the years I never even dared to imagine until all of a sudden I was in it, exhausted physically, emotionally, and forced to make decisions I didn't feel ready for. Welcome back, everyone, to my channel. I'm Dr. Ava, a medical doctor, and on my channel, I basically talk as if I was giving advice to my younger self. Doing medicine or any other demanding career is hard enough already. We don't need to do it alone. So, my channel is a community where I not only give big sister advice or insider advice, but I help you feel less alone. And by psychoanalyzing each experience I felt during this career, I hope to help you understand yourself more and hopefully help you navigate this experience we all share. So let's get back to finishing med school. Yes, you might be close to finishing, and it really helps to see the light at the end of the tunnel. But at the same time, this is the time where some of the hardest decisions have to be made, and that creates a whole different kind of pressure. One of them is choosing your specialty. For me, when I had to choose my specialty, I felt like by committing to just one path, I'm giving up all the other possibilities, as if I was closing the door on every other possible versions of my life. The feeling was similar to choosing a partner. When you're committing to one person, you're simultaneously deciding to give up all the other possible life paths you could have with different people. But this way of thinking stems from a scarcity-based mindset. You have so many options, and yet you only see limitations. But in reality, you are always only gonna choose one thing. You are never gonna live all of those lives. So it makes no sense trying to entertain what ifs. Just to be clear, I'm not saying that settling and that a compromise that's certain or a specialty that you're only half happy with is always better than uncertainty or just waiting until you find the right one. I am merely suggesting to look at making decisions differently. They are not final and they are not set in stone. They don't determine every upcoming detail of your life. You have the chance to make decisions every single day that shape your life. It's not up to this one everything defining decision. You always have options to shape your life into one that fits you authentically. And once you actually start working in a specialty, you will probably realize that there are so many different career paths and lifestyles within that specialty that you could only discover when you're on the inside. If you think this way, you will realize that choosing your specialty, just like with choosing your partner, as long as it's not unhealthy for you, you can always shape your life into one that fits you authentically. The other side of this coin is the fact that you will probably find some things in any specialty that you don't necessarily enjoy as much or you would consider it a downside. And being able to point those things out even before applying for the job doesn't necessarily mean that's not the right fit for you. Probably just means you're making an informed decision. Now that we have the right mindset, I want to give you a few thinking points to look at when making your decision. Ask yourself what your most important values are. Is it having free time, maintaining your physical and mental health outside of your workplace, having a strong personal life? Then probably a lifestyle-friendly specialty is what you need. Or do you value excitement and a challenge? A work environment that keeps your brain sharp and builds a strong community within the workplace. Then an intense or high-pressure field might actually make you feel more alive. Try to pick 5 of your most important values and see how they would unfold or be fulfilled in some of those specialties. It can be difficult or take some time to think for yourself, as we're so used to always doing what we're expected to and pushing through any feeling of repulse or discontent. In med school, you couldn't ask yourself what you want. You just had to do what was required. And on top of that, you don't even really have time to think about it properly. Every single day is optimized for studying for the next deadline. So when you suddenly have to make a big life decision, you feel overwhelmed, rushed, unprepared, because you were never given the space to really think about it. So try to consciously push against this and crave out a little time here and there for this, for you and your future. What helped me make my decision was thinking in very practical terms. What kind of patients, procedures, and work schedule can I actually tolerate or maybe even enjoy? Let's dissect patients. Do you care for your patient's age? Do you want to work with young people, old people, people close to the end of their lives? Do you want your patients to be generally healthy with one specific problem they need you to fix? Or are you okay with patients whose general condition might be worse? Or you have to treat them with conditions that are progressive and there is no statistically significant chance for improvement? You're only treating this disease to slow its progress. Basically, how important the outcome of your patients is for you. How much contact do you want with your patients? Do you want to form patient doctor relationships, or do you want it to feel like paying in a supermarket super fast and probably never seeing that person again? Or even if you see them, it's just for a couple of minutes. Let's discuss procedures. Do you want most of your procedures to be surgical and non surgical? Are these procedures learned through your residency program, or do you have to later on do more special training to be able to perform these? If you want to do surgical, think of what kind of surgical is it? Is it microsurgery, or do you need lots of physical strength to do it? Are you performing the surgery alone, or you have help and you always work in a team? What are the risk rates or the outcome rates of procedures you're probably going to be performing? And last but not least, are you grossed out by this organ you're planning to do procedures on? How do you want your residency years to look like? Do you have to do on-call shifts early on, like whole weekend long ones? And bear with me on this one because I know that in America you don't have a choice. But for example, in my country, how much residents have to be on call depends on their specialty, depends on their training program, and even the work environment, like how many of you guys are sharing the workload. Still within working schedule, how often is urgent cases in your specialty? So if you're on call, how likely is it that you're never going to sleep a minute when you're on call? Or can even urgent cases wait until the morning? Consider your options after residency. Is this field flexible for me if I want a family? Or what options do I have in academia if one day I decide I don't want to work with my hands anymore? I wanted to elaborate on this question, how much you're willing to sacrifice short term for longer term rewards. There are some specialties that are super great, both lifestyle and earning wise, after residency, but the residency years are extremely hard. I personally had to be honest with myself and decide that med school have already pushed me to my limits. The length, the pressure, the workload. I wanted to choose a specialty that allows for a more friendly lifestyle even during residency. Next step, once you have made your decision, is how to secure that position. The application system is very country specific, so you have to do your own research early on to know what it takes to secure positions. Is it a big exam that determines everything? Is there a point system or an interview? And to figure out what actually gives you advantage. For me, I started going to the department I later applied to about a year in advance. Not necessarily because I had something impressive or unique to show, but to be familiar by the time the application came around. This matters more than you might think because even subconsciously, people are more likely to choose someone they recognize. It's also useful to look at the people who were accepted to that specialty before you, how they present themselves, how they communicate. Is there special requirements for appearance or confidence that you can work on? Having practical work experience in that field is always the most valuable on application if it's not determined by a specific exam or a grade. And if you have to write a motivational letter, always include the experiences that are relevant to that field so that at the end it doesn't look like this position is just one of many options for you. It has to be aligned and specific, like you've spent all these years preparing for this one position. Another exciting and demanding part of this year is that all the big life events and social events closing this chapter of your life are already happening, whether you're ready for it or not. Graduation, celebrations, ceremonies, everyone is excited for you. Your family is involved, your friends are involved, and you're trying to coordinate everything while you know deep down that your future is not even fully secured yet. And there's also a pressure to look and feel your best at these events. After months of studying, stress, and barely taking care of yourself, you're expected to show up perfectly. And so there were times I felt defeated in this area. And these people already see your achievements as granted and they think you have it so good. When in reality, you're working your ass off and technically you're still just a student. You don't have a job yet, you don't have a salary yet. And most of your acquaintances will only see the lack of responsibility here and think that all you do is spend your time at these fancy events celebrating yourself. But in reality, this is one of the most demanding and stressful parts of your life. And the duality of how people see and treat you can make you feel like no one really understands. Now, let's get into how I survive this period day to day because mindsets and feeling sorry for ourselves will not be enough. Let's talk about my daily routines and my secret weapons and little tricks that got me through. During intense studying periods, I pretty much did the same routine every single day. This allowed me to be able to predict my progress and how much time I have to finish the things I wanted in this day. Mornings, I love. Mornings are a fresh start, a new chance to get in a good, productive day, loads of progress, and a fresh, well rested nervous system. I would take my nutritious breakfast and my morning chai to my studying station, and I would enjoy picking today's theme of Pomodoro studying videos. You know, you have like 3, 4, 5, 6 hours long ones. And I wouldn't necessarily stick to the Pomodoro technique, but it just made me feel like I have options for the day and set the tone for the day. These little luxuries take up zero time, but the difference they make in your experience is crazy. You go from barely surviving and fighting for your life to a diva that has options. And you can decide if it's cherry blossom studying today or if it's matcha latte studying today. Honestly, you hang into anything you can at this point. I always had my notebook out, and sometimes I would even write a few sentences to start my day and set the intentions for the day, highlight the top priority topics I need to cover today, or just write a couple of things to my journal. Having a notebook out can help you when studying and your brain wants to interrupt you with something extremely important that you will have to do, and you cannot forget this. But you can be distracted this easily. If you have your notebook on the side, you just write it there and you continue studying for any kind of brain dump or things that seem urgent at the time, but in reality, they are just distractions. One of my secret weapons was actually how good I was at taking breaks. Taking breaks are just as important in preparation for an exam as the study routine itself is. A break needs to relieve you from all the pressure for a while, delete the hardship from the topics you've dealt with so far, and restore your mood to baseline. Basically, it's like a mini reset to get you back to the condition that's optimized for studying. My first bigger break was lunch, at least 20-30 minutes to enjoy my food, and my other secret weapon, cartoons. Yes, cartoons are a serious chapter of this video, as they were one of my biggest secret weapons during. Honestly, it wasn't specific to final year, but I heavily relied on it in the final year. But I already was watching them in the third year, for example. Cartoons help you completely disconnect within a record breaking short time. 20 minutes an episode. They leave you feeling light and grounded without making you feel like you're missing out on life, without giving you FOMO, taking you on an emotional roller coaster, or making you too hang up on the plot to be able to focus on studying quickly again. It's genius. My favorites were Gravity Falls, Phineas and Ferb, and DuckTales. Sure, there are more, but these have loads of seasons and episodes. And continuing on this thought, my toolkit didn't end there. You know, everyone has those days where at the end of the day, you're ready to give up on everything, throw away what you've worked on so far, and just have a breakdown. So, on these days, the thing that kept me going were my never give up movies. My never give up movies were Legally Blonde and Mulan, the Disney animated movie. So, what are your never give up movies? I'd like to know. Okay, let's get back to continuing my routine. The second break, after the lunch break is movement time, at least before the sun goes down, which is a challenge in the winter seasons. An hour-long walk while seeing the sun out is basically gonna allow you to keep functioning and feeling like a human being. You can either enjoy your favorite podcast during your hot girl walk, or you can catch up on active recall if you're so behind. This is not only a time for self-care and for keeping you feeling like a human, but it's an intentional tool to maximize your brain capacity, to restore your focus so that you can continue where you left off. After walk, I would finish my routine with stretching, taking a shower, cooking myself a healthy dinner, and enjoying it with my cartoons, as you know. Dinner was my longer break, about 1.5 hours, and afterwards I would sometimes continue studying until I fell asleep. I don't necessarily recommend this, it doesn't work for everyone, but for me, I really needed that extra, like 1.5 hours of studying after dinner. Okay, in my next chapter, I wanted to talk about preparation for the state exam. This is might not what they call it in your country, but I'm sure you have at least one huge exam closing this chapter, or an exam that defines if you get accepted to your dream specialty. So you know what exam I'm talking about. The thought of having only one chance to nail this exam can be terrifying and destabilizing. So many possibilities that could go wrong. What helped me was affirming to myself that I have done this so many times before. I have passed difficult exams and showed up on exams even when I wasn't feeling my best. This is not something new. It's just the final version of something you already know how to do. At this point, the only thing you can really do is to just trust yourself. Tell yourself that the preparation for the exam was the hard part, and you showed up to that and completed it genuinely to the best of your abilities. Showing up to the exam and doing it, that's just autopilot, nothing to think about. Okay, that's it for confronting the scary stuff. Last piece of advice I would give to anyone is to celebrate everything along the way. Every small success, celebrate it. You truly, truly deserve it. Giving yourself everything you'd give to someone you want to see succeed is not celebrating in advance, wasting time or money. It is an investment and a crucial part of maintenance. Showering yourself with love, resources, and rewards are like watering the flowers you want to see blooming. You don't want to live with regrets, right? Don't miss out on feeling accomplished and like you're doing the thing, because you are. Even if it feels like cosplay for now. You are not just a student. You are in one of the most demanding seasons in your life, and you are handling it. And that already says a lot about you. Well, that's it for today's video, guys. I hope it gave you the feeling I wanted it to give. And if there's one thing you want to take from this video, take the last point. You are worth celebrating, and you don't hear that often enough. See you guys in the next video. Bye.